What can people do about this risk? Well, there are secondary insurances that people can have or do have, depending on what it is exactly, and we'll talk about those, to fill in these gaps in A and B. If you're low income, Medicaid program. The Medicaid program serves as secondary insurance for the low-income person to pay what Medicare A and B do not pay, and pretty much pays 100% of it. If you retired from the military, if you're actually a military retiree and you are drawing a retirement benefit, you and your family are probably eligible for TRICARE for life, and that TRICARE for life will serve as secondary insurance to Medicare. If you work for an employer who gives retirees a employee retirement benefit, it is quite possible that that employer plan will continue after you turn 65 and will serve as secondary insurance to Medicare. Some years ago, you could say that with definity, that if you got an employer plan and it continues past 65, that it will be secondary to Medicare. In the recent history, some employers actually do not offer to retirees an indemnity-style plan that will work secondary to Medicare. What they offer them is a Medicare Part C Advantage-type plan that really is a private replacement of their Medicare benefits. And if they choose to stay in the employer coverage arena, they actually opt out of the benefits of A and B to stay. And I'll get there in a minute about Part C. And then for everybody that doesn't qualify for one of these things automatically, anybody on Medicare has the option to buy what's called a Medicare Supplement plan. Medicare Supplement plans are standardized plans. The government actually says there's right now plans A through L. Beginning June 1st, 4 of those are disappearing and 2 more are coming along. But basically, these are standardized plans that the government says that a company, if they want to sell an A plan or a B or a C or a D or an E or whatever, has to fill in exactly this group of gaps in Medicare. Basically, to oversimplify things, an A plan is a very basic plan. Every plan includes this basic set of benefits. C plans cover almost everything, and F and J plans cover everything. So you've got other plans in between that cover some combination of these deductibles. The wonderful thing about supplement plans is, number one, there's no fine print in them. The government tells them what they're selling, so every company sells the same thing. Number two, what's great about them is that companies make no coverage decisions. If Medicare says they're going to pay their share, the company is obligated to pay. So you're dealing with a private insurance company, but on a almost just send check basis. And providers do not care who your supplement plan is with, because their relationship with this supplement plan is cashing their checks, and they are very willing to cash anybody's checks that'll pay them, I'm certain. So supplement plans are quite straightforward in terms of the benefits. The disadvantage to a supplement plan is you got to pay for it to have it. Supplement plans run in round numbers, and your age and so forth influences this. Anywhere from around $100 a month to as high as $200 a month if you're older, and depending on what. Every company has different prices. They're selling identical benefits, but with different prices. And it relates to exactly the grouping methods involved. We really don't have time in this setting to discuss it. At SHIIP, we publish a brochure that actually deals with this. It's actually a book that discusses the whole subject, a Medicare Supplement comparison guide. Our website lists all the prices of the company and explains the options. I encourage anybody that is looking at Medicare supplement plans, and if you're counseling, to use the book or the website. The one thing to remember is Medicare supplement plans have an initial 6-month guarantee issue period. When you first trigger your Part B benefits, you have a 6-month window from when those Part B benefits begin, and that can be because you were disabled or because you turned 65 or because you delayed B and started it later. Whenever that B date, it triggers a 6-month period when anybody on Medicare has the right to buy a Medicare supplement plan, regardless of health, with no underwriting at published prices. Once that 6-month period goes away, you can try to buy one anytime you want. There's no period when you can or can't, but the company has the right to underwrite you. They can deny you coverage based on health conditions, or they can give you any price they want. They can accept you, but with a price substantially higher than what is published for the guarantee issue period. There are other periods that may come along when this guarantee issue might pop up in some form related to losing something. If you have secondary insurance and you lose it, you have an employer plan and the employer cancels the coverage, there are some guarantee issue situations that come along. If you move to a state that where the current plan you have doesn't exist, you get guarantee issue rights. Gina, did you have a question?
So if somebody, even if they're in the midst, and we just had somebody asking us about this, turning 65, got active cancer, very sick, they have guarantee issued. They don't have to fill out a health question. Do they have to fill out the health? I mean, they're not underwriting it. Is there a health questionnaire?
Some of the plans may ask you some health questions, and the only thing that matters is you don't lie. But as long as you tell the truth, they can't consider it.
But why do they give you the questionnaire?
I don't know. It makes little sense other than to document that you did tell them the truth. But they have no right to use that information. They have to accept you, and they have to accept you at their published prices.
And at the published price. That was the other thing. Thank you.
So yeah, that is a wonderful, but it may only be a one-time event. So when somebody's looking at buying a Medicare supplement plan, they need to think past, I'm real healthy right now, to I may never, if tomorrow I have a heart attack or I'm diagnosed with cancer or I have rheumatoid arthritis or something that's long-term and expensive, I may never be able to have that opportunity again. So although you can always try to get a supplement plan. They don't have to take you. That is secondary coverage. You've got original Medicare A and B. You don't want to assume those out-of-pocket expenses. You buy secondary coverage. There are other parts of the Medicare program. I want to skip to D, then I'm going to come back to C. Remember, we discussed that A and B of Medicare don't cover prescriptions. If you don't have prescription coverage in your TRICARE plan or in your employer plan, then you, as well as anybody else, has the opportunity to buy a Medicare Part D prescription drug plan. These plans are sold by private companies. There are 45 plans available in North Carolina this year. There were 47 last week. One company was excluded. The premiums for these plans run anywhere from $17.30 a month to over $100. There's absolutely no reason to believe the $100 plan is more than the $17. Is better than the $17 plan. Medicare drug plans all cover different drugs. They cover them with different administrative requirements, and they cover them with different copayment requirements. The way you choose a Medicare drug plan, and you SHIIP volunteers out there know about this, is you run the drugs that you take through a Medicare.gov website tool that analyzes your drugs against all 45 plans. At SHIIP, we spend most of our year doing this. The one period you can do it is when you first are eligible for Medicare, you make this choice. And then every year between the 15th of November and the 31st of December, you have the opportunity to change. There is no underwriting involved. You just find out which plan you want and join it. You cannot pick a plan logically without having the drugs you take run through this program. And the program prioritizes the plans 1 through 45 based on what you can expect to pay in premiums and copayments during the preceding year, annualizing your current situation. Obviously, things change, and that's why every year they give you the ability to change. So Medicare drugs, although they're not covered by A and B, you've got that Part D option that gives you drug coverage as part of the Medicare program. Everybody should have a Medicare Part D plan. If you choose not to have one, there's a penalty involved. If you pass up Medicare drug plan when you're first eligible, you certainly every year have the ability during these annual enrollment period to get in. However, you will be assessed a 1% penalty in premium of the national average premium, which is low 30s this year, so 30 cents a month roughly, in penalty for each month that you waited to get into the Medicare Part D plan. So if you wait 3 years, you're going to have a 36% penalty applied to the national average premium for the rest of your life as long as you're in a Medicare drug plan. Now, everything I've just talked about these drug plans relates to those who are above certain income levels. The Medicare drug plans involve a number of programs that subsidize participation in these plans. I'm not going to go into the numbers today, but if you think you're eligible, the cutoffs for the plans run for an individual about $1,353 a month in income and $12,500 in assets. For an individual married couple, $1,821 a month in income and $25,000 in assets. If somebody falls within these guidelines, they need to be talking to hopefully SHIIP and letting us direct you to the correct source of assistance, because you can get your premiums paid, you can get your co-payments lowered to affordable levels, far less than other people pay, and it also eliminates the gap or donut hole in the Medicare drug plan. Medicare drug plans are set up for those that have no assistance to end after a certain coverage period of dollar. They pay actually the first $2,800 worth of drugs you take each year at full price. You have coverage. After that, you have about a $3,700 gap in coverage when you are expected to pay full price for your drugs. And this is an annual thing, starts over every year. Those with assistance don't face this. They don't have the gap at all. And actually, those with assistance can change drug plans every month. If you have any level of assistance, either through the Medicaid program, through the LIS program, have the option to change plans every month. The one thing we haven't talked about, and I'll close with, is Medicare Part C, Medicare Advantage plans. These plans came out some years ago and are basically private insurance plans that one has the option that has A and B to exchange their benefits under A and B for coverage by a private plan. There are a number of plan offerings across the state. Every county's plans are different. The service areas of the plans are by county. The options in every county are different. These plans basically mirror the benefits of Medicare in that they cover the same things, but with completely different co-payment responsibilities and different access to providers. Medicare providers don't necessarily take Medicare Advantage plans. Anyone joining a Medicare Advantage plan needs to be very aware of the acceptance of their plan by providers in their area. And when we talk about providers, you certainly think of doctors, that's the first place. You think of hospitals, that's second. But you also need to think about hospitals beyond your local hospital, because you may need a referral to a more major central hospital that requires more services. So that hospital, the labs that hospitals send their specimens to, you would need to be aware that they might be a problem. Skilled nursing facilities can be a problem. Home health care agencies. So anyone that you deal with in the Medicare world or the medical care world is a provider that you need to be aware of the limitations of their acceptance of these Part C plans. Part C plans, many of them include some additional benefits that Medicare doesn't cover. They include limited, they're never full coverage, but they may include some limited dental or vision benefits. Medicare Part C plans a lot of times incorporate your drug plan into this one simple package. It's where it's much like what you have when you're a working person. You have one thing, it provides all your coverage. So a Medicare Part C option is something that's there. Not so long ago, there were many of these plans that you basically paid your B premium and you paid no additional premium. The trend in Medicare Advantage plans is to pay something additional to your Medicare premium. You see plans, there are still a few zero premium plans. You see some in the $20, $40 range. You see some in the $60, $80 range. And you see a few that's premiums are more than $100. So you need to be very aware that this is an option that's available to you, but what you're actually doing is exchanging the benefits of Medicare A and B that we discussed for a completely different set of copayments. And different does not necessarily mean better. The copayments in Medicare Advantage plans can be higher than they are in original Medicare. It depends on the plan and the service. One advantage that Medicare Advantage plans have over original Medicare is that they cap your annual out-of-pocket costs at a certain number. If you have a Medicare A and B and nothing else, no cap. If you join a Medicare Advantage plan, most of the plan, I'm sure they all do, have some cap in the $2,500 to $6,000 range. The one thing to be aware of, and you need to, and every plan is different, is everything doesn't count toward the cap, and everything doesn't stop when you reach the cap. Drugs aren't involved at all ever. And in a lot of cases, doctor visits don't apply to your copayments for doctor visits, don't apply toward the cap, and don't cease once you've reached the cap. So again, your Medicare Part C plans are one of the options. You got A and B original Medicare, D for drugs, and C an option to when you have A and B. Generally speaking, and this is a generality, people that have only Medicare A and B, Part C is a logical choice. If you've got secondary insurance to Medicare through some other program and you plan to keep it, original Medicare A and B work much more simply with secondary insurance than any Advantage product does. So those options are part of what we deal with.